how the county is handling that, but also importantly, a viewer is asking and specifically targeting you and asking, we need Bwana Simiyu to tell us, they began doing, I think that's the county, a drainage in Imara Daima in anticipation of the rains. When the president said there will be no heavy rains, the contractor suspended operations, left open spaces, you have manholes all over. Now the rains have come back, however, they are not yet back on the site. It's an ISO, and we have the tarmac roads which have been damaged and mounds of soils heaped on the walkways. Is the county aware of this, and what is it doing about it?
Well, thanks, Zainab. Let me also say that our plans and programs are not on the basis of pronouncement. A number of programs and activities go us sort that out. And so we have, each county, we now have at least 2 trucks. We recently acquired about 27 new trucks to help us cut away garbage. We've deployed backhoes, we've deployed excavators to each of the sub-counties. Our Marshall Plan has been cascaded to the sub-county level. So in a situation where we have this concern, what I would urge my colleague Nairobian to do is report this to the ward admin, who will cascade this to the sub-county admin. At the sub-county level, we have a sub-county environment officer, we have a sub-county works officer, who are able to pick up these concerns on a daily basis, and we receive daily reports from the sub-county teams on matters such as this. I'll give you an example. We've had persistent problems with the General Madenge drive, which has been flooded over some time. But based on the feedback from the public and activating the sub-county admin administrative teams on the sub-county level, we were able to deploy a rapid response team which went and identified the cause of that constant flooding is a new development that is coming up. And we were able to have a conversation with the developer and got him to, working together with our engineers, we were able to, find an alternative pathway for the flood water. And as I speak this morning, I believe that that road is now free of that problem. So just to appreciate that could be weighed. Back to the issue you talked about, you will recall that His Excellency Governor Sakaja commissioned the 7,000 strong community health promoters, the CHPs, who basically are taking public health to the household. Now, this team has been at the forefront of engaging with the public and sensitizing them and engaging with them and creating awareness on safe hygiene practices. In many cases, even distributing aqua tabs for safe and cleaning water. So we have a very deliberate program that is ongoing to ensure that you don't get these secondary disasters that are triggered by floods, such as I think one of the honorable members mentioned, these disease-related disasters that may arise. Because what that does is that then it stretches our resources. It then takes us away from our core business.
But that is certainly likely to happen. We're going to see an increase in waterborne diseases as predicted.
Yes.
Are you able to counter that and give support to those especially most vulnerable who will be affected by, these kinds of diseases?
Absolutely. And I think just to also remind you that in the recent past you've seen, contrary to the past, we now have medicine available even in the in the small clinics and hospitals, even in the low-income areas. So access to health has been enhanced. The community health practitioners are the forefront, leading this charge against this disease. Will you have instances of this humanitarian focused workers, the UN agencies?
Your final remarks.
Okay,
Let me begin with Daktari, as why